Afternoon, everyone, and thank you for joining us for another insightful session to cover passing and mastering Med-Surg and Pharmacology in nursing school. We encourage everyone to put their questions in the chat. We'll address those if time permits at the very end. There will also be a poll, so please follow the graph icon in the right-hand side so that you can participate and give your response. I would now like to pass it over to Chioma Okeke, registered nurse and founder of Choosing Nursing.
Hi, hello everybody. Thank you so much for having me here. Let me go ahead and pull up my presentation for you guys. Okay. All right. Okay. All right. Hopefully you can hear me and see me okay. All right. Okay. All right. Okay. All right. Okay. So welcome. Thank you so much for having me here. I'm so excited to be here before you guys. I'm going to be talking with you guys all about passing Med-Surg and Pharmacology. So let me first kind of go into a little bit and share a little bit more about myself really quickly. So my name is Chioma Okeke, or I go by Nurse Chioma. And I've been a registered nurse for a little over 13 years. I have a story, I applied to nursing school 3 times before I was accepted to the program. So that was very challenging. I went to San Diego State. And then once I actually got into the program, I failed Med-Surg. I had to actually retake the semester all over again. And then I remember when I was in the process of going through nursing school, I honestly found myself saying over and over again, I'm quitting because it was that hard. And then I, through the encouragement of my family and friends, I kept going. I saw other people dropping out of the program while I still kept on trying. And I finished nursing school. And then after I finished nursing school, I got my first nursing job. I was forced to, unfortunately, resign for my very first nursing job because it was very, very hard, very rigorous. And then after that, once again, I felt like, nursing is not for me. I'm not supposed to be a nurse. It's too hard for me, And eventually, after I, got myself out of that funk, I got another job, and I was able to gain experience. And it actually happened to be a Med-Surg tele job. And from there, I got transferred, I got promoted, I obtained leadership positions, I precepted other nurses, and then eventually I started Choosing Nursing, which is the name of my company now. I helped almost 1,000 nurses to actually pass their NCLEX exam, with 50% of them being repeat test takers. And then I've been featured on different channels such as blacknews.com, yourblackworld.com, the African Cable Network, and everynurse.org, as well as many others. So I say all this not to brag or boast, but honestly just to show you that it's not really about how you start, but really honestly how you finish. And you have to be willing to just kind of honestly motivate yourself and encourage yourself through it all, because I know it can be very discouraging at times. But if you put the right people around you and you listen to the right things, you can finish, you can get to the cross line. Okay, so I want to ask you guys a quick question, and hopefully they're going to be able to put this up in the poll, is which one is going to describe you, all right? So let me know in the chat or in the poll. 1, you haven't started your nursing school, and you're currently looking at programs right now, okay? 2, you are taking your prerequisites right now to get into a nursing program. 3, you're in school now and you're taking Med-Surg, pharmacology right now, literally, or any other class in your nursing program. Or 4, you already graduated from your nursing program, or you're literally about to graduate. So let me go and make my screen smaller so I can see what you guys' answers are in the comments. Let's see here. In the poll. Okay, I see 3. I see 3, 3, 3. Okay, so lots of 3s. 4. Let's see what else. Okay, so lots of 3s. Okay, awesome. Okay, perfect. All right, and you're taking both Med-Surg and Pharm this semester. Okay, awesome. 2, you're on accelerator program. Wow, good. Okay. You're in a program right now. Awesome. Okay, good. Thank you so much for answering that. That helps me a lot to get to know you guys better. And then also really tailoring the information to you guys. Okay, so now that I know that, I want to talk to you about what makes Med-Surg so challenging. I will tell you right now, when I was in nursing school, I hated Med-Surg. Okay, that was my least favorite class to go through because it was so hard. Like I said, I failed it the first time and I had to retake it all over again, which is really embarrassing. But now I teach it all the time and people understand it from the way I teach it. So this is what makes Med-Surg so challenging. It's honestly how vast the content is, 2, how detailed the information can be, and 3, the fact that the information is way more abstract. So it's because it's not like other subjects. There's actually a statistic that says that obtaining a bachelor's of science in nursing degree is by far the hardest degree to get in college because it's different. The way that you have to learn the information is not the same like it is with other subjects. So here's an example of what I mean by this. So for other subjects, as long as you study, as long as you actually commit time, right? It's all you really honestly, seriously need is time and focus for other types of majors. As long as you commit the time and you spend the time memorizing information, you can learn those topics rather quickly. So this is going to be, for example, like history, English, psychology, maybe computer science, right? So for your other like classmates that's in other majors, it's more of a linear approach, right? What they put in, they get exactly out, honestly, because it's really all about your ability to memorize information, and then you can, pass the exams. But when you get to Med-Surg, it's a lot different. And to me, I remember one of the things I felt like, and I later realized, is that Med-Surg, it can honestly feel like you're learning a new language because there's a lot of different kind of steps you have to take to understand the information well, And for Med-Surg, it's almost as if the topics kind of intertwine because there's different layers of the information. And like I said, it's a lot more detailed information, which makes it very hard. One of the things that I found, though, for a lot of people that are struggling with Med-Surg is oftentimes there's a step that you either missed before you got to Med-Surg that you need to review or that you're weak in. So, for example, if you are weak in anatomy and physiology, Med-Surg is going to be very hard because everything is meant to build upon each other. All of it. It's meant to build upon the next thing. So a lot of times, if you're struggling in Med-Surg, there's a prerequisite that you still have not fully obtained in comprehension, and that's why you're struggling. So it really matters how well you do in the previous courses, and sometimes you just honestly have to just kind of go in and fortify that knowledge and fortify that information again. So here's some of the tips that I recommend that's going to help you to pass Med-Surg. And I really hope that what I'm sharing is not going to be just what you already heard. Honestly, I try to provide as unique information as possible. But at the same time, it's also principles that do apply. And you just have to honestly do it a lot more with Med-Surg. So for one, I definitely recommend using books, multiple books. When I retook Med-Surg the second time, which is like I said, more than a decade ago, what helped a lot was getting more books. I know it sounds crazy, right? But I had to get the books that broke down the information in an easier way to understand. So like, for example, the 1,000-page Med-Surg book that we had to take in class was okay, but what really helped me was simplified books that kind of broke it down in a way that's easier to comprehend. And then of course, you need visual aids. Like if you're a visual learner, just put that in the chat. Like, I'm a visual learner. If you're a visual learner, you need to also maximize visual aids. Some things are not going to click until you see a picture of it. Honestly, some things it's not going to register as quickly until you see it in a visual format. So visual aids is really huge, and like I said, you want to do this a lot with everything. And then also hands-on training. So when you're in your classes, maximize everything they give you. Office hours, right? If there's time where you can go in and touch, like for example, I know with clinicals, come in early, leave late, right? If there's time where the nurse or whoever you're precepting with can allow you to, you want to, pull out this med, or you want to just volunteer for everything. Okay, volunteer for everything. Be as hands-on as you can, because it really does matter. Touching things, it's called kinesthetic learning. Touching things is really important, and be mindful of how you learn best. One thing I found for a lot of students is that they will study, but the reason why they're not really retaining information is that they're not aware of how they actually learn best. So you have to really think about this. Okay, how do I honestly learn best in the past? Is it writing things down? That means you're a kinesthetic learner. Is it hearing? That means then you're auditory. Is it seeing? That means you're more visual. And you can be more than one too, but you have to do those things a lot more. Flashcards is also really important too. That was really huge. So for example, you put on one side a disease process, and on the other side you put the signs and symptoms, the risk factors, and etc. And then sometimes too, another thing that helps a lot is video breakdown, right? So being able to honestly watch a video that breaks down the information. Sometimes you can read something in like a book and you get it, it makes sense. But then when you watch a video, like, oh, okay. Oh, that's what they mean by putting the Foley in, right? Oh, okay. Okay, that makes sense now about listening to the lungs, right? So a lot of times when you see the enactment of it, somebody actually carrying it out, that also helps a lot. So get you 2, 3, or 4 YouTube channels that's your favorite. Go ahead and subscribe and follow them hardcore if they're going to really break down the information a lot better for you. So here's what I'm going to do. I'm going to actually test you guys. I know you probably were not thinking this, but I'm going to show you an example of the power of visual aids. All right. So here's what I'm going to do. I'm going to have you on a piece of paper, right? Before I show you the next slide, actually, on a piece of paper, I want you to write this down. Okay. So what you're going to write down is heart failure is, all right, I'm going to say it as slow as I can. The definition of heart failure is the inability, all right, the inability of the heart to pump adequately, which results in inadequate tissue perfusion and breathing, all right, and respiratory issues. Okay? All right. So once again, let me say one more time in case you didn't get it. The definition of heart failure, right? We're not talking about right or left yet. The definition of heart failure is the inability of the heart to pump well, which results in inadequate tissue perfusion, breathing, and respiratory issues. Okay, so now here's what I want you to do. Now go ahead and put that paper aside, okay? And tell me what I just said in the chat box. All right, go ahead and put the paper aside. Tell me what I just said in the chat box. Let me see. Let me see what you guys are able to say. All right. What would you say it is? Okay, inadequate pumping. Yeah, okay. All right, I saw one answer. Hard, right? It's kind of hard, right? The inability of the heart to pump effectively. Okay. All right. Okay, I see. Okay, good. Okay. So it's not that easy, right? When you're just hearing it only or it being said. Okay, inability to pump properly. Inability. Okay, good. Okay, awesome. Okay. So it's not as easy when you hear it only, right? When you hear it only, or you're writing it only, right? Now, let me show it to you. Let's add some visuals to this, all right? Let's add the picture part, and I'll show you the difference. Heart failure. So here's a picture of heart failure, all right? Here's a picture of heart failure right here, showing it to you. So heart failure is essentially the inability of the heart, like I was saying, to pump sufficient blood to meet the needs of the tissues for oxygen and nutrients, right? Now look at this. Here's the difference here's a normal heart on the left side, and then here's a heart that's not working on the right side, right? So you can see everything looks pretty normal on the normal heart here, but then with the heart that has heart failure, you can see how the ventricle is bigger than it's supposed to be, right? It's more enlarged, right? Because it's not pumping adequately, it has to pump harder, and so as a result, it results in it being more hypertrophic than it's supposed to be, right? So now let me ask you a question. Between me telling you what heart failure is, and versus right now me telling you, plus you seeing this picture, which one are you more likely to remember, right? You're more likely to remember, like, for example, if you're, taking like an exam or something, you're more likely to recall this picture along with the words, right? It's going to probably recollect to your mind a lot more faster. And so that's why you need visual aids, because like I said, Med-Surg is like learning another language. And so you have to incorporate as much different types of content to help you to really master it. Another thing too is key words. All right. So here's one of your tips when it comes to understanding and learning heart failure. All right. Or in general, disease processes related to Med-Surg. You have to pay attention to key words. This is what's going to be more highlighted on when you're taking your nursing exams. And many times keywords are the pathophysiology of the disease, the signs and symptoms, right? These are usually the key words. So in this example here, I put in bold one of the most significant keywords. And typically when you're taking later on, like you're taking your nursing exams, you'll see questions that'll be presented where it won't tell you that it's heart failure, but it will use the same keywords. And you have to do detective work and figure out what they're talking about. But if you kind of was, just running through everything and you didn't really pay attention to the key words, you're not going to be able to recognize what it is. So with right-sided heart failure, the right ventricle fails. It results in congestion in the peripheral tissues. The viscera predominates, which results where the right side of the heart cannot eject blood and cannot accommodate all the blood that normally returns to it from the venous circulation. So with these patients, you're going to see increased venous pressure, right, which leads to JVD, jugular vein distension, and increased capillary hydrostatic pressure throughout the venous system. Okay, so this is what you see with right-sided heart failure. But with left-sided heart failure, it's more pulmonary issues. So pulmonary congestion, keyword that is bolded for you, occurs when the left ventricle cannot effectively pump blood out of the ventricle into the aorta and the systemic circulation. Pulmonary venous blood volume and pressure increase, forcing fluid from the pulmonary capillaries into the pulmonary tissues and alveoli, causing pulmonary interstitial edema and impaired gas exchange. Now, if we had a little more time, I would actually go into nursing diagnoses, because this would be an example right here of impaired gas exchange related to, the inability of effective exchange because of the alveoli being collapsed, right? So here's what's going on here. We have a left-sided issue, all right, or left-sided heart failure, where there's pulmonary issues going here. So one of the things that also will help you too is acronyms, all right? So acronyms, one thing I tell students is okay, With left-sided, think lung. Left equals lung. So that's like a small way to kind of remember it. And to differentiate between the two is you're going to see more pulmonary issues. These are the patients that they're going to have the frothy sputum. They're going to have the crackles in their lungs. They're the ones that having the more of the pulmonary issues. Okay, so this is an example here of showing you right versus left-sided heart failure. And just pay attention to the key words. And like I said, you do this with all disease processes. Is you're mindful of, you're highlighting the pathophysiology, and you're paying attention to the signs and symptoms and what makes them different, right? Especially when you see something that's similar, separating them by identifying what makes them different. And then also the treatment, right? That's also very important too. I like to tell people think about what's going on with the patient, right? And then that will help you to better understand what the treatment is. So they need to reduce their salt intake, because when they retain more salt, they retain more fluids, and that affects their blood pressure and their heart and etc. So they need to restrict their fluid intake. If they're smoking, they need to stop smoking. And then also we want to give them Lasix, such as furosemide, to get rid of that extra fluids. So a lot of times these patients, when they're in the hospital, they're going to be on a Foley catheter, because we need to monitor their strict intake and output. And if they're elderly, then they need to have like a bedside commode, or, it's just something to reduce the risk of fall. And then the last thing too is high Fowler's positioning, right? So they need to have their head up, so that way they can be able to breathe well, okay? Otherwise, they're going to have issues with their breathing. And this is oftentimes how you know they're getting worse, is if they need more pillows behind their back to breathe better, all right? You probably didn't think that you were going to get an actual Med-Surg teaching today, but I wanted to give you a core example, so that way you have some type of framework to work with, okay? Okay, so how you guys doing? Doing okay? So now we're going to move on, and we're going to talk about pharmacology, all right? Let me check in on the chat real quick. Make sure you guys are doing good. Bit of both. Okay, awesome. You guys doing good? Picture. Yay, good. Okay, I see the comments now. All right. Okay, awesome. Okay, so now I'm going to talk all about pharmacology, all right? This is your favorite subject, right? Right? Good here. Awesome. Doing good. All right, let me know in the chat you guys are doing okay, all right? All right, so now we're going to talk all about pharmacology. Whose favorite subject is pharmacology, right? Probably not. So I know for a lot of people, pharm is one of the areas that they feel is so hard, right? It's so hard, but it doesn't have to feel that way, okay? Okay, so let's talk about how you can pass pharmacology. Here's one of the things. A lot of people think that pharmacology is just knowing the drugs. It's not. There's more to it, actually. Let me give you some of the different topics that all falls under pharmacology. One, being able to administer blood products, because that counts, all right? That falls under it. So blood product administration, evaluating the client response, knowing how to access venous access devices, such as central lines, implanted lines, portacaths, peripheral lines, also knowing dosage calculations, people's favorite subject, right? So being able to do calculations, being able to evaluate the patient's response, which is therapeutic effects, which is what we want, side effects, and adverse effects. Being able to evaluate how the patient, being able to educate the patient about their medications, right? So, what's Lasix? Why am I taking it? I don't understand. So being able to tell the patient that, right? Being able to prepare the meds, right? Understanding the rights of medication administration, right? It's like, I know now it's honestly 10 rights. It's not just 5 anymore. Being able to know what information you need to review before you give them the medications, right? So is this contraindicated? Are there specific lab results you need to know before you give it? Do they have allergies? Are there other drugs they're taking that could interact? Being able to participate in the medication reconciliation process. So just kind of balancing out what meds they're taking and making sure they're taking the right meds and that nothing is interacting with each other. Being able to titrate the meds appropriately based on their assessment, right? So you don't just give insulin blindly, you give it based on their glucose levels, right? You don't just give blood pressure medications blindly, you give it based on their blood pressure, right? So being able to adjust the dose based on the assessment, all that's part of pharm. Also, being able to evaluate the appropriateness and accuracy of a medication, being able to monitor the IV infusion, also being able to manage their pain as well. Also, as well, when it comes to controlled substances, witnessing that, right? Being able to know how to witness and waste. And then also parental nutrition, which is going to be your TPN medications, right? So understanding how to give TPN, why we're giving TPN, and what you need to monitor while they're on TPN. You need to, so some of the strategies I recommend is you need to be able to identify what are the potential contraindications of the med, like I mentioned earlier, prior to giving it. A huge, huge tip to help you to memorize the meds is organizing them, all right? Putting them into groups, classifications, and categories. And in a minute, I'm going to show you an example of what I mean by this. But you have to, the better you can organize the drugs, the faster you're going to learn them. You're not going to learn it quickly if you're learning them one at a time. It's going to take you forever, honestly. So here's an example right here, okay, where you organize it. So I have it organized, I have the classification in one column, an example of the drug name, and this could also be the suffix or the prefix. So in this case, it would be fluoxetine for levofloxacin or fluoroquinolones. And then for beta blockers, we have metoprolol, atenolol. These are all examples of the generic name, but OLOL is the suffix which corresponds with that classification. And then I have organized the rationale. So what is the ideal outcome? Why are we giving it? And then you need to know at least 2 side effects that can likely occur as a result of them being on this medication. That way you can identify, okay, does this contraindicate with this patient or any other drugs that they are taking? So this is one that I teach all my students, is breaking it down or organizing it into groups, classifications. It helps you better with organizing and memorizing the meds. And I put them into flashcards as well. That also helps with learning this information. You want to also pitch into side effects, a specific side effects of specific medications, and you should know the side effects versus adverse effects. Okay, so side effects and adverse effects are 2 different things. Side effect is often an undesirable effect of taking the medication, an undesirable effect of taking the medication is a typo. And then adverse effect is a life-threatening effect of taking the medication. All right, life-threatening. So meaning that the patient could die if we don't stop it immediately. So side effects doesn't always require stopping the medication, right? You need to, when it comes to meds and diseases, you need to know what to do just as much as you need to know what it is. One more time, you need to know what to do just as much as you need to know what it is. So with side effects, it doesn't always require stopping the medication. Sometimes it can just be treated. So for example, with antibiotics, they're usually going to have upset stomach, but we're not going to stop the antibiotics. But with adverse reactions, though, you need to stop it immediately, and then they may need to have something to reverse the effect, and we need to tell the doctor. And then another thing, too, is that you got to pay attention to keywords, right? Keywords are really, really important as well. Like I was mentioning with the suffixes and the prefixes, and then also the order of giving things. A lot of nursing exams, especially when you get to the point where you take the wonderful NCLEX exam, it's going to test you on your ability to recognize the correct order of doing something. So so first let me give an example of keywords. Here's a question on the screen, which is: the client is admitted for care after traumatic brain injury. The client has a history of atrial fibrillation and obesity. Which prescribed medication does the nurse question? A, warfarin, B, aldosterone, C, mannitol, or D, pantoprazole? Okay, as you're thinking about it, all right, let me go ahead and break it down and show you guys the answer. So, atrial fibrillation, what do they usually take? They usually take Coumadin, right? But it says that they had a TBI, right? Which means that they have a high risk of bleeding right now. So if you combine the use of taking Coumadin with a bleed, they're going to bleed intensively, right? It's going to be a huge problem. So for this situation, my answer would be A, warfarin, right? The client may have taken warfarin at home for AFib, but it's unsafe anticoagulant use immediately after a brain trauma. So the ability to recognize those key words and think critically will help you to answer difficult questions like this, right? So treatment of clients with comorbidities is complex. The client with a traumatic brain injury is most at risk for progression of that injury and brain death. The nurse uses measures to reduce the risk of bleeding, decrease the ICP, and to minimize complications. The incidence of complications increases due to comorbidities. The client's atrial fibrillation is not the most likely issue for this client. However, continuation of the warfarin Coumadin could result in a significant bleed and irreversible progression of the brain injury. All right, and then last but not least, as well, like I said here, patient to the order of blood transfusions, right? Patient to the order in general, but an example here is giving blood, right? So there's a specific order of how we give blood. We check the order, we do the cross matching and typing, then we obtain the vital signs, we practice strict asepsis, we get another nurse, right? Because you need 2 licensed nurses. And then we check these 5 factors here: the serial number, the blood component, the blood type, the RH factor, and the expiration date. And then also, before you do all these things, you want to make sure that you have an 18 gauge or 19 gauge needle to allow for easily flow of the blood. All right. So this is essential. This is an example where knowing the order is important, because later on when you are actually doing this in real life, you need to know the correct order. Otherwise, this can affect the patient. And then also, when you're looking at exams, they may mix up the order and drop, like those type of questions, or select all apply questions, or etc. All right, so the final tips is use all these tips, all right, everything, not just 1 or 2, to help you to crack the code to successfully passing both Med-Surg and Pharmacology. All right, so that's pretty much it. So I will go ahead and take any and all questions that you guys have. All right.
Thank you so much. Let's start with the first one. And I know you've given a lot throughout this whole presentation, but can you give study tips for adults working and going to school?
Yes. What I would say is you need a job that's honestly flexible. Because so one of the things, so I'm not sure what type of job that you have, but if you can work maybe like a night shift job, or a job where things are kind of slow, so that way you can study during like your breaks or when things are kind of down, that would help a lot. If you can also, also nothing too, I would also talk with your manager as far as like if they can be flexible with your hours. It's honestly going to depend on the job. I will be honest with you. When I started nursing school, they told us at the beginning not to work. That's actually what they drilled into our brain. Don't get a job. You're not going to have time. That's what they told us. But if you have to absolutely work, if you can adjust your hours, see if you can get something more flexible. Ask your manager if you can switch to the night shift, so that way you can be able to work when things are more down and you have more time to study. These are some of the things that I would recommend to help you.
Thank you so much. And, going off of that, we had a question in the previous session just asking for advice on, do you address the educators and, your different programs about this work-life issue where they feel like they're being set up for failure? Say that you really do need a job that's critical in your life. You have to juggle a family. Is there a way that you should go about getting advice or talking to an educator about this?
I would talk to somebody. Honestly, what I recommend doing is talking to more than one person, because everybody's going to give you a different answer based on their experience. and their point of view. So don't allow just one point of view to, discourage you or anything like that. I would honestly talk to multiple people. And even sometimes you don't have to necessarily talk one to every single person. Sometimes it could honestly be a video that where somebody is sharing their on YouTube or something, they're sharing their experience about how they were able to work while they went to school. So it's really going to require like, dedication, maybe like not getting a whole lot of sleep all the time. But I would talk to more than one person, and then I would have a job that is flexible. I would talk to my manager as much as possible. Tell them, you know what, I'm committed to working here, but I'm also in school. So have that conversation before ahead of time, so that way your manager has like a heads up, that that you are in school and that you need, a little bit more grace. And then what I've seen a lot of people do too is that they adjusted their commitment. So for example, they were full time, but then when they started school, they switched to per diem or they switched to part time. So it just kind of depends on what type of job that you're working.
Someone actually asked, what's the name of your organization?
Choosing nursing. Choosing nursing.
All right, next, how do I balance studying for both current lessons and during school and NCLEX focus study?
Okay. So you're in school and NCLEX. Oh, okay. Well, I think it kind of depends on like what the commitment looks like. So, for example, because I know when I was taking or getting ready for the NCLEX towards the end of the semester, we were taking like leadership classes. It wasn't like as hard as it is at the beginning, So, like as far as balancing, you're gonna have to honestly get a planner. So you need to get a planner. And you need to be attentive to every single time that you have. So I get one of those planners that's by the hour, and so for example, it will say, okay, from 6:30 I wake up or something, right? Maybe even earlier than that, honestly, maybe like 5 o'clock, wake up at 5 a.m., get ready, get dressed, blah, blah, blah. And then you're at clinicals at 7, from 7 to 5. And then you dedicate, okay, from 5 to 7, I study for the NCLEX on Mondays. On Tuesdays, from 7 to 9, I study for my classes. So what I recommend is that you get a planner and you organize your time and you dedicate specific days of the week where you're going to commit to NCLEX and specific days where you commit to your classes.
All right, let's move on to I am taking both Med-Surg and Pharm this semester, and I'm worried about how to study for exams that are scheduled so close to each other. How can I plan for preparing for these exams without feeling so overwhelmed?
I would, if you can get a study group, that would help a lot. Like if you can find a study partner, at least one, sometimes the more the merrier. One of the things that helped me when I was also in nursing school is I had people to study with, and there's a few advantages of doing that. One is that like what you're weak in, somebody else may be strong in, and vice versa. And so like, oh, I struggle with Pharm, but you're good at Pharm, and you can help one another in those areas. And then also, it also really helps with the camaraderie that when you're spending time with other people that's in the same class as you, the same program as you, like you find yourself, laughing at the same time, joking around, but you're also learning and studying simultaneously. And so it kind of honestly helps to decrease the anxiety and the pressure that you're feeling because you're doing this with other people. So I would recommend, if possible, if you find yourself some study partners, and you can devote time, okay, every Friday, Saturday, we're going to meet at the library and go hard, and it really honestly helps to relieve the pressure. And then also, if you are struggling with learning it, if there's a tutor available, at my nursing program, we actually had a tutor that was free of charge, that was included in our program, which helped a lot. So I would meet the tutor along with other students during the class as well. So those are the things I would recommend. Honestly, not doing it alone, because like you could do everything and study everything, but the overwhelming part by yourself, it will feel overwhelming if you do it by yourself. But if you connect with other people, it will help to alleviate that burden.
All right, we had one more come through the chat. Let me go ahead and pull it in. How far before the NCLEX should you start adding NCLEX specific studying, especially if you're still interested, or sorry, if you are still in school?
So what I would say is this part is a kind of tricky question because it honestly depends on the nature of your program. Okay, it depends on your school, your education that you're getting. So what I've seen, you're so welcome. What I've seen is that for some people, like for example, if you're going through like my nursing program at the time, I know it's not the way it is today, because today you can become an RN in like a lot faster. But my education, it was a 5.5 year program, which include the prereqs and the actual program itself. So we started studying for the test 3 months before we took it, while we were in nursing school. But if you're in more of an accelerated program, or your program is not as strong, right? Like meaning that you feel like you learn everything yourself, then you should devote 6 months before you take the exam. Okay, like while you're in school. That's what I would highly recommend. It honestly depends on how strong of a program you're in right now. Like if you're going through a really good program, like, oh yeah, I feel like we weren't self-taught. Like I'm actually learning the material. I feel like I'm confident with this information. Then maybe like 2 to 3 months while you're in your nursing program. But if you feel like, man, like we really carried the weight ourselves, then give yourself 3 to 6 months ahead, little by little. And as you get closer to your test date, you increase the amount of studying that you do, right? So for example, let's say, for example, I'm graduating from nursing school in May of 2024, right? And so right now it is October. And I feel like, man, this program, I really carried the weight. Like me and my classmates, we did everything, then I would do little by little, like around December, January, I would start just doing a little bit, maybe like devoting only like, half an hour per week max, like not a lot. And then once you get closer to March, April, then by that time you're studying at least 5 hours a week and more, right? And then by the time you get your test date, maybe like 10 or 15 hours per week. So it's almost kind of like a snowball effect, but you're going to increase as you get closer, and it depends on the program.
Thank you so much. And it looks like we're just about wrapped up with questions. I feel like with what you presented in the beginning, you've gone through so much and you know that there's a struggle. It is very challenging. If you could go back to yourself, back in the past, where you knew you were at the hardest and lowest point in your studies and in your nursing school program, is there anything that you would tell yourself now?
You're gonna make it. That probably would be the biggest thing. Yeah, man, I feel like I'm gonna cry now. Man, yeah, you're gonna make it. That probably would be the thing I would have told myself, is you're gonna make it, no matter how hard. The reason you gotten this far for a reason. That's what I would have told myself. Gotten this far for a reason. You didn't just get into the program just to fail. Like, so I probably would have told myself, like, you're actually gonna make it. Like, you have to tell yourself that you're gonna make it, and you have to ignore. That's why I would listen to the past presenter, and I totally agree with what she was saying as far as your social media, positive affirmations. All this stuff matters so much. It matters a lot. The last thing you need is to, finish a 12-hour Med-Surg class, and then check your feed, and somebody says, if it's not working for you, just give up. Right? And then now you're like, oh my gosh, maybe I should quit nursing school. Right? So like, yeah, no, I highly recommend. What I would have told myself is I would have said to myself, you're going to make it. That's what I would have told myself. And that would have helped me a lot. So, and there was actually one more question I saw in the chat. I think what was missing, it was something about lookalike questions or lookalike meds.
Oh, you're right. Okay, what happens with look-alike, sound-alike questions or meds? Let me put that up there. There you go.
Yes. Okay, good. Awesome. So, you have to be careful with lookalike meds, because I know there's some meds, not a whole lot, not too much. There's some meds that do sound kind of similar. And so sometimes the meds sound similar because they honestly are similar in the sense that they serve the same purpose. Like they have the same suffix ending. So they have the same rationale. And then there's some meds that sound similar, but they're totally different. Like I remember there's I can't remember off the top of my head, but there's one group of meds that one is an antibiotic, and then another one sounds very similar, but it's actually a chemotherapeutic agent, which means it treats cancer. And so honestly, the best thing to do is flashcards, repetition. And so you need to address the sound-alike, look-alike meds while you're studying, right? So that way you don't make that mistake, when you're passing meds, when you're doing exams, when you're in your class, etc. You need to recognize that while you're studying, right? That really is going to honestly make a huge difference. So being mindful of that, and then breaking down the word, breaking it down. A lot of words, they have root meanings, and then they have different suffixes, prefixes, and then they have different side effects. So if you recognize them ahead of time, and then you break it down, oh my gosh, it does all of a sudden now like, oh, I know what that is. Like, oh, that's so obvious what that is. So yeah, so that's probably the biggest advice I would give you guys.
All right, we do have one more. What about balancing work, school, and kids? I barely have time to read materials, but trying to prepare for core courses, especially since my courses are only 8 weeks long.
Let's see. So that one is a doozy because I don't have kids yet, so I can imagine how you feel. Here's a couple, but I do have students that have been who have kids and have succeeded though. Here's the first thing. You got to tackle each thing one at a time, okay? So first, when it starts with your kids, okay? I don't know how old your children are, but you need to have a conversation with your children, okay? Like, unless they're like, 5 months old, then no. But you need to have a conversation with the kids and just tell them, okay, look, mommy or daddy, we're studying for this really important school right now. If you are good, mommy will take you to Disneyland every single day, every day for like a year. I'm just maybe not that far-fetched. But if you allow mommy to like pretty much setting boundaries with your own children, when you see mommy in the room here, it means don't enter. Okay. It means quiet time. Right. So honestly, you're going to have a conversation with your children. Like that's what one of my other friends did when she was in her school. She had to tell her children, mommy's having quiet time right now. You can't come into the room. Okay. When you and then you reward your kids. You give them some type of reward. It can be something as small as, whatever you think that they would find, rewardful. But you have to have a conversation with your kids. That's the first part, right? And then your spouse as well. The second thing when it comes to work, once again, seeing if you can talk with your job. Also, make friends with your coworker. Okay, become friends with your coworker because you're gonna find yourself in a position where you have to, hey, can you cover me on Friday night or Saturday night or Monday or whatever, right? Just be as friendly as possible with everybody that works with you. So that way, if you need to, you can get someone to cover you here, cover you there, right? And then in addition to talking to your manager, and then if you need to, hopefully not, but if you don't see yourself long-term at that job, then maybe consider getting a different job that will allow you to, balance both school and work. So these are some of the things I would highly recommend.
All right, and to wrap it up, we will have one last question. Do you have a link where people can find your NCLEX review if you have NCLEX review?
Yes, absolutely. So I'll put on here. So the next NCLEX review I have is going to be at the end of this month. I don't have the link yet, but you guys can connect with me. You're welcome on my channels as well as also on my other website. So our website is www.choosenursing.net. And then my YouTube. Probably the YouTube is the best way because that's where I announce anything that's going on. Let me put it here on here. Let me see if I get. Now maybe I should make the screen bigger. I don't know. So the YouTube channel is youtube.com / I am Nurse Chioma. So that's usually where we announce, like, you know, when I'm gonna have a review, the next one that's coming up, and then also, or you can follow us on Facebook. If you follow Facebook as well, facebook.com / choosing nursing, or you can follow me on Instagram, which is instagram.com / nurse Chioma _ all right, the underscore, that's the correct Instagram channel. All right, so those are the best places, but definitely follow me on YouTube. I have hundreds of videos where I go over Med-Surg and pharmacology, especially if this is something that you really need a lot of help in.
Well, thank you so much. Have also linked that in the Learn More button. You guys have any additional questions, you can always reach out to webinars@truelearn.com, as well as Chioma has kindly given some of her social channels if you're looking for more information. This concludes our summit, so we really thank you guys for giving your time today. We will be sending the recorded sessions out tomorrow, as well as our giveaway winners for our social giveaway if you ended up participating in that at all. So we are wishing you all the best of luck, and you still have a little bit of time to catch the football game if that's what you're into. So thank you guys so much. Have a great rest of your weekend.